Hello friends, good morning and welcome to my global presentation. My name is Festus Sadu of World of Viruses. I have no doubt you have been following my video and by this time you have an in-depth knowledge of what viruses are and what damage they can present to your body. Do you know that your liver can be under attack by these viruses? That's why I'm speaking to us this evening on viruses and your liver. Viruses and your liver. Let me quickly tell us something about the human liver. Do you know that the liver is the largest internal organ in your body and that it performs a very important function in your body's system? It is a critical organ in the human body that helps to support your metabolism, immunity, digestion, detoxification, and vitamin storage. One very important function of the liver is that it clears from your body toxins and other poisonous substances. And yet, this same liver is the target of a group of viruses called hepatitis viruses. Not only one or two of them, but about 6 families of viruses. Yes, about 6 families of viruses. Maybe you don't know that viruses organize themselves into families. Yes, they do. The five hepatitis virus families have one thing in common. They have affection, they have predilection for your liver. They have liver. Although viruses are not the only cause of liver damage, one common sign that your liver is being damaged by virus is the appearance of yellow coloration, which we normally refer to as jaundice, yellow coloration of your eyes and the other lighter part of your body. How is it transmitted? It's very interesting. Transmission depends on which family of the virus. Hepatitis B, hepatitis C, and hepatitis G, of course, they are all transmitted through infected blood, through sexual intercourse, Whereas hepatitis A is quite different in its mode of transmission. It's transmitted by injection of contaminated food or contaminated water. Once the virus gets into your body, it set up the infection. This is the mode of transmission of the virus. This is how the virus is transmitted. The presence of virus-specific receptor. Why is the liver so susceptible to this virus, to hepatitis viruses? It's because of the presence of virus-specific receptors, which are located on the liver cell membrane. This facilitates the entry of the virus and set up the infection, which can be acute, chronic, or hepatocellular carcinoma. That's the last stage. Let me quickly say something about this. Hepatitis can either be in form of acute, chronic, or develop into hepatocellular carcinoma. For hepatitis A, for example, injection of the virus is through our mouth into the intestine, the target organ, but the target organ, of course, is the liver. For hepatitis A, it rarely develops into chronic form. There are no chronic carriers with hepatitis A. But hepatitis B, which is the most serious of them all, about 5% becomes chronic carrier due to the persistent. What is responsible for this persistence is because of the prolonged presence of the virus hepatitis surface antigen, which I'll be talking a bit about as the lecture goes on, in the blood. This is about 1% of this 5% of that become carriers will eventually transit to hepatocellular carcinoma. This is the most dangerous part, and this is what may eventually lead to death. So hepatocellular carcinoma is thought to be due, please, let's understand this, is thought to be due to the persistent regeneration of dead hepatocytes. What do I mean by hepatocyte? The liver cells with new ones because of the persistent regeneration. For hepatitis C, for example, it differs in the form of virulence. It differs a bit from hepatitis B. It strongly disposes to hepatocellular carcinoma. Remember, I just told you that only 1% for under hepatitis B, only 1% will transit to hepatocellular carcinoma. But with hepatitis C, about 50% may develop hepatocellular carcinoma. Actually, to aid this is alcoholism. If you are an addict, if you are alcohol addict, you may be doing a lot of damage to your body, to your liver. Something about this hepatitis C again, it's unfortunate. It's unfortunate, as serious as it is, there's no vaccine against it. The next stage is the hepatitis D. Hepatitis D needs virus hepatitis B for its replication. It does not exist on its own. So hepatitis B is the carrier for hepatitis D. One very bad aspect of this is that a co-infection of hepatitis B and hepatitis D will always lead to the fulminant form. Co-infection of both will lead to a very fulminant form and can be really very, very serious. Who told us this? How do we diagnose? How do you know? What is the diagnosis? How do you know you have hepatitis? The clinical manifestations of hepatitis are visually the same. They are visually the same, irrespective of whether it's caused by A, B, C, D, or so on. Although the level of severity may be different. The level of severity may be different. What do we see? What do we see? Hepatitis is characterized by jaundice, the serious yellow coloration of the conjunctiva or the other lighter part of your body, the skin, the palm of your hand. Then we see what again do we see clinically? What again do we see? We see enlargement of the liver, fever, anorexia, loss of appetite, feeling like vomiting, nausea and vomiting, pale feces, and of course dark urine. These are all very, very pathognomonic. These are very, very, very pathognomonic for the virus. There are different stages. There are different stages. I've talked to her about jaundice or no jaundice, but there are different stages. What is the pre-jaundice? Before the appearance of jaundice, what do we see? At this stage, hepatitis can be confused with other viral diseases. What do we see at pre-jaundice stage? There will be headache, the patient will be complaining of headache, rashes will come, arthritis, minor arthritis, joint pain, and again vomiting. The next stage again, which is now, again here, what do we see? We see enlarged liver, pain in the right costochondral rib, in the right side of the rib. You remember I told us that your liver is situated at the right side of your stomach. Epigastrum, you feel like vomiting acid, as if you are vomiting acid. As if you are vomiting acid. And what do we see again? At the end of this, we see appearance of pale colored stool. Why do we see colored stool? Because bilirubin is not mixing with the stool in your small intestine. So that is why your stool is pale. Again, what do we see still on the jaundice stage? We see yellow coloration, yellow coloration of the mucous membrane. It intensifies now, and the sclera, and again the skin. Again, one important thing you see here under the jaundice stage is there's protein in the liver, because the liver is damaged now. And the liver is damaged, and the vascular system is also damaged. So the protein will flow into your kidney and appear in your urine, and again in the blood. You see the dark. What do we see with the urine? You see the dark coloration of the urine. Again, what do we see? Part of clinical symptom. You can see that hepatitis present a good clinical symptom. So you can actually not miss it. But you still have to know which. But from all these things, you cannot pinpoint that this is caused by hepatitis A or hepatitis B or hepatitis G. So what do we see again? We see hepatomegaly, enlargement of the liver, tenderness of the liver, especially on the right side of your stomach, enlargement of the spleen, another organ of the body which is responsible for production of your blood, or the hepatopoietic organs. You see the enlargement. After all this, remember I told you about 5%, for example, for hepatitis B, about 5% will transit to chronic hepatitis. What do we see here? And it's mainly seen. Chronicity is seen mainly in hepatitis B, hepatitis D, and hepatitis D. And what is responsible for this chronicity? I told us because of the continuous the continuous replication of the hepatitis S surface antigen. What do we see again? Fatigue. The patient will be complaining of fatigue, even without walking. Digestive tract symptoms, stomach pain, dull pain of the liver, tenderness, and elevated liver enzyme. Oh, I'm going to spend some time describing this. These are ALT and AST. These are the liver enzymes that is stored in our liver. But because it's stored in the liver, it's stored inside the liver, inside the uninfected liver. But once the liver is damaged, these two enzymes, they flow out. They flow out and mix with your blood. So what the chemical pathologists look for, and this is really very, very important for the clinical diagnosis, for the diagnosis of hepatitis, there will be an elevation. There will be an elevation in those two enzymes. There will be a raise in that enzyme because it's now flowing freely. It's now flowing freely from your liver. Easily diagnosed clinically and in the laboratory. But all this, which I have just told us, that you still have to do your laboratory diagnosis for confirmation. For confirmation, this will tell you that probably this is caused by hepatitis A, hepatitis B, or hepatitis C, or hepatitis D, or co-infection of the three. So what do we see here? We look at some very important antigens. The product of the virus, the product of the replication of the virus in your body. We see appearance in the blood of the various related antigens and antibodies. The most important of them is this HBs antigen. This is the surface antigen. This is the very first antigen to appear. This is the very first antigen to appear. This is the one that is showing you that you have been infected. This is the antigen that is showing that you have transited you have become positive, that you are infected by this hepatitis. Again, just at the same time as hepatitis surface antigen is appearing, anti-surface, anti of that antigen also appears. There is also hepatitis E antigen and hepatitis B DNA, nucleic acid. This is really very, very important, and it's a very bad indicator of the progression of the disease in the patient. The appearance of HBV DNA is showing that the virus is replicating. It's replicating seriously. It's replicating. It's multiplying seriously in that patient, and this can even lead to very bad effect. Now, what is the treatment? No response to antibiotic. Please know this. There's no response to antibiotic treatment, but one good thing, the good news I'm telling you all this evening is that even there's no antibiotic, but there are well-developed antiviral drugs. This one area virologists, pharmaceutical companies have done a great work. We have the following antiviral drugs, which are very, very effective. Interferon. Interferon is the very first line of action. Lamivudine, adenofovir, entecavir, and tenofovir. Please note this. These are not antibiotics. These are not antibiotics. So please don't, if you are diagnosed with hepatitis, don't run to your pharmacy going to buy antibiotics. You'll be doing more harm to your body. You'll be doing more harm to your system. See your doctor or physician that under no condition should you do self-medication. Under no condition should you do your self-medication. If you have been diagnosed, just run to your doctor. Prevention and control. Prevention and control. If you remember, I told us on the beginning, the virus can be transmitted through unsterilized instrument, needle, drug abusing, through drug abusing. So, unsterilized instrument is a culprit, can easily transmit this virus, especially for hepatitis B, hepatitis C, and hepatitis D, and hepatitis G. Again, very, very important. You remember I also told us that this virus can be transmitted through sexual intercourse. Therefore, abstain from unprotected sex. Abstain from unprotected sex. Vaccination is still the best way of prevention. Vaccination is still the best way of prevention. From the very first slide I showed us, hepatitis A and hepatitis B are vaccine preventable. They are vaccine preventable. They are vaccine preventable. We are still looking for a vaccine for hepatitis C, even though as serious as it may be, there's no vaccine yet. Virologists are working on this. Drug companies are also working on this. So, but for the meantime, vaccination is still the best way of prevention. Well, how do we prevent vaccination? How do we do the prevention? How is the prevention How does it go? If one good thing now is that WHO has deemed it fit to introduce the option for adding hepatitis vaccine to infant vaccination. There are 3 stages from what we are seeing on the board. From your just look at your right, you see from that thing that's been projected. Hepatitis vaccination has now been incorporated into infant vaccination, and is usually in 3 stages. For the first 3 months, the first stage you can get the first stage is that hepatitis 1, the first dose, followed in the second month by the second dose, then followed by the third month by the third dose. In the second option, you can either the first month you can give hepatitis the first dose, or in the second month you can omit the hepatitis second dose and third dose in the second and third month respectively. Then in the third option now, both hepatitis 1, 2, and 3, given both at second month, third month, and 4th month, 6th month, respectively. Whereas the last dose, you see, parents, there's a lot of option for you. Mothers, there's a lot of option for you. There's no mean where you should miss this vaccination. The last option is hepatitis at 2nd month, and then you will make the second month. Maybe you travel, you didn't have the chance to go to follow up. Then the chance is still open for you at the 6th month, where you get the second dose, and the last month, which is the 9th month, coupled with your measles, the third dose. So, can see, prevention and control is very easy. Make sure you vaccinate your children. Make sure the children are vaccinated. One good thing now, which I just told us, is it's already introduced into the EPI. For hepatitis B, active prophylaxis. What do we do? After birth, this is just what I just told us in those slides, in 1st and 6th months, when a mother is HBs antigen positive, you know what I mean by HBs now, by this time. This is the first antigen to appear when a patient seroconvert, when a patient is infected. When a mother HBs is detected in a mother, such a mother is positive. A child from that mother should be vaccinated in 1st, 2nd, and 12 months. Please know this. It is recommended that such babies born to HBs positive mothers should be given, alongside with the vaccine, they should also be given human immunoglobulin. This will be very, very effective, especially if the mother is positive. If the mother has been diagnosed and HBs antigen has been detected in the blood of that mother. For other one, let's see what follows again. I just told us about hepatitis B active prophylaxis. See your doctor. Here in the US, I know they will do it. Even when we go for our physical, either we are sick or not sick, either we are diagnosed or not diagnosed. So our doctors, our physical, our primary physicians will always advise us to make sure we are current in our hepatitis B vaccination. This one advice from me. Are you thinking of marrying that beautiful lady or that handsome man? If yes, know your hepatitis status before you tie that knot. You know the reason why? Because this is especially hepatitis B. Is a virus that can easily be contracted through sexual intercourse. So before you tie that knot, you and your spouse go for your would-be wife, your would-be spouse. Go for your hepatitis status. Go for your hepatitis status. It's very, very easy. Nothing frightening about this. Nothing frightening about this. It does not say you should not marry that beautiful man or marry that beautiful lady. So the positive individual, this is what will happen. The positive individual should get treated with the antiviral drug immediately. If hepatitis surface antigen is found and that individual is found positive, one of those couples is found positive, so the positive one will go for the antiviral drug immediately. Whereas the negative individual should get vaccinated immediately. The vaccines, I just told us, vaccine is very, very effective. Just run to your doctor. make sure you, the only the time you are presenting for that is positive, you make sure that after that drug, you make sure that jaundice, every other symptom had disappeared before we have anything to do with your couple, or you go for protected sex. Ladies and gentlemen, I hope you have enjoyed my video this afternoon. Hepatitis is such an important virus, such an important disease, but it's really very, very much preventable. So please, continue to follow my video. I hope you are getting a lot from all this, and you are learning more and more about viruses. But for you to learn more, please, always follow my video. Always follow my video. Make sure you subscribe. If you are not subscribed up to now, make sure you subscribe. Please share, comment. Share, comment. I would like to hear more from you. More and more of the video will be coming from me. And I'm sure you'll be getting a lot from following my lecture. We'll be talking more of viruses as well as more and more. So please, I'll be expecting you in my next video. Thank you for listening, ladies and gentlemen. Anywhere you are listening for me globally, thank you for listening. I appreciate you spending your time with me. I hope to see you more during my video. Thank you. Have a blessed day. Thank you very much.